Hi, my name is Wendy Gomez, and I will be talking about improving mental health access from the Emergency Department Act of 2019. We will cover what this bill is, what stage it's in, what impact it's going to have on clients, communities, social workers, and organizations. We will begin by discussing what this bill is. This bill awards grants to introduce innovative methods for people experiencing an acute episode of mental health. For example, major depressive disorders, persistent depressive disorders, um, and presenting to an emergency room. This bill would provide grants to institutions with emergency rooms that provide care to those in need of stabilization of an acute mental health condition. The institutions that could receive the grant will use these funds to create, support, and expand programs to assist people who are being treated at these institutions' emergency rooms for any acute mental health episodes. The funds would also support the different services, such as staff needed to provide an expedited, appropriate placement for any patients in need of any inpatient care services. The funds would also increase the inpatient psychiatric beds and other alternative care locations like regional psychiatric facilities. This bill is fairly new. It was just introduced this year in May, so we'll have to see where it goes. The impact that this bill could potentially have on clients is that it would provide any extra coverage of the different services that are needed for those individuals who are requiring any acute emergency care for any of their mental health conditions. I believe that this bill would also impact any communities by increasing the capacity of patients that are being seen and being appropriately treated by any acute mental health episodes. This bill would also impact organizations by providing funds which would assist in the expansion of psychiatric hospitals, and by this increasing the bed availability for those who are in need of those inpatient services. I believe that this policy could also increase the interest in people towards mental health careers by providing more education, and with this, increasing the mental health staff. The impact that this bill could potentially have on social workers, I believe, is just a few different ways. The demand for social workers would increase, therefore, increasing job opportunities. But with that, could also come a negative thing that could impact those social workers is that it would increase the workload the social workers are receiving because of the high demand of patients coming into these facilities. I believe that this would also give social workers and other mental health professionals the opportunity to be proactive instead of reactive when it comes to any mental health conditions.